Health chiefs in Sheffield are looking at better ways of treating mental health issues among people from black and minority ethnic backgrounds. The city's Health and Social Care Trust admits it's not done enough to help or understand black communities. But now things are changing, as Mark Ansell reports.
Angela suffered with depression and was suicidal, but didn't feel comfortable accessing support.
I didn't want to be labelled as another black person, another black woman as having mental health issues, and there's shame attached to that as well. It would have been embarrassing. I felt it would have been embarrassing for me, it would have been embarrassing for my family. We never really talked about mental health, and I didn't want to become another statistic, so I hid.
Ursula also has mental health problems. She set up Adira, a survivor-led mental health service for black people in Sheffield.
Educate, educate, educate. From the top CEO, as high as you can get in that particular organisation, right down to the cleaner.
They want the NHS Trust, which provides mental health services in the city, to be more accessible for black people.
Get culturally appropriate, culturally competent, culturally sensitive training for your staff. You come to Burngreave, you come to Spittal Hill. Stop asking us to come to you. And when we do come to you, I want to see somebody who looks like me. I want to see a black therapist. I want to see a black receptionist.
Welcome to Black Mental Health Live. My name is Natan Medina.
Adira was supported by the NHS Trust in holding an online conference about black people's mental health. It was watched live by around 2,000 people. It's one of the ways the Trust says it's improving how it works with black communities.
What they see is that when black people access our services, there's a disproportionate number that end up being on wards and being detained under the Mental Health Act. We need to work with black communities, black families, black individuals to ensure that where they need the support at that early stage, we can offer that to them.
Peter Isabor is one of few black clinical psychologists who works for the Trust.
It's definitely given me, I think, a little bit of an edge in terms of understanding what it's like to be marginalised. You know, when I think about a lot of the people that we work with, whether that's in the inpatient ward, whether that is in the one-to-one, you know, in the therapy room, we work with the sort of the most vulnerable and the most marginalised people in society. That's where these experiences are the kind of experiences that lead to mental health problems.
With Adira and the NHS Trust now working together, it's hoped black communities will become more comfortable accessing mental health support when the need arises. Mark Ansell, BBC Look North, Sheffield.